done. You're live.
Okay, so good morning, board members, and good morning, any members of the public who are observing the meeting of the Isle of Wight Health and Wellbeing Board today, Thursday, the 23rd of July, 2020. Just going to check who is available and participating today so that I know. I'm obviously here. I've seen Michelle, I've seen Bob Blizzard, Michael Lilly, I've seen Claire Mosdall, I've seen Paul Brading. Could you give us a roll call from there on in, Marie, just to see who's joining us today? Steve Crocker, I can see.
We've got a couple of people on the phone. I'm not sure who they are.
Okay.
Hello, you've got Sarah Jackson from the police on the phone. Unfortunately, I couldn't get through on the link.
That's okay, Sarah. Good morning. I see we have Michelle Legg. And we've got Megan Jones.
We do. We have one other person, looks like. Oh, no, that's it.
Marie, that was me, because like Sarah, I couldn't get through on the link until I found a back route in.
Okay, then.
And Marie, Laura Godian here instead of Carol Tozer.
Yeah, cool, got you. Thank you.
Good morning, Laura. Welcome.
Thank you.
Okay, so that gives people an idea of who is on the. A couple of things. If you could all just go to mute, please. That'd be the first thing. Second thing is there is a chat line, as we have always with the Teams system, which if you have any comments you wish to make, please feel content to put them in the chat line. One way or another, we will be monitoring them. Can I just remind everybody the chat line is also recorded, so it's always appropriate to put things in there that are appropriate. And now we have an agenda before us.
Chairman, just before you go on, may I come in as the Chief Executive, just to say that...
you were here, John.
No. Thank you for that, Chairman. I think the chat bar is more for indicating if people would like to speak rather than making specific comments, because they can't be seen by the public. So if members could just restrict the chat bar to indicating they would like to speak on a particular item, please.
Yeah. Marie, are you able to monitor that from your position?
Yes, not a problem.
If you note, just draw it to my attention, that'd be great. Okay, so item 1 on our agenda today is the minutes which have been circulated. These are the minutes of the meeting held on the 16th of January at paper A. I'll take it that they've been read. Is there any member who wishes to make any comment in terms of there being an inaccurate entry? Otherwise, I shall propose that we note the minutes and accept them. Just pause a few seconds to give people a chance to. Mr. Lilly, did I see your hand come up? You want to speak? You need to come off mute. Michael.
I was just proposing the minutes, that's all.
Excellent. That's excellent. Do we have a seconder? Mr. Brading, thank you very much. So it's proposed. All those in favour, just show by raising your hand if you would. Thank you. We'll take those minutes as read. And so item 2 on the agenda is declarations of interest. This is where I invite any members of the board to declare any interest they might have in matters on the agenda that they haven't already declared as part of their role in their members' interests or otherwise, accepting that the primary entries on the meeting today relate to health and wellbeing, and I'm sure it has a general effect for all of us. Okay, I'll pause a second, just see if there's any comments or issues. Not seeing anything. Okay, I'll now move to item 3, public question time. This is a maximum of 15 minutes. However, questions must be delivered in writing or by electronic mail to Democratic Services no later than 9:30 on Tuesday, the 21st of July, 2020. Each question must be given the name and address of the questioner. Marie, am I correct in assuming we have no questions?
None were submitted, Chairman.
Thank you. And on that basis, I'll move on to the next item, which is item 4. This is the local impact of COVID-19. And it's my understanding that we're about to have the pleasure of an extensive and robust presentation from our Director of Public Health, who's going to give us an update on the local impact of the pandemic, as outlined briefly at paper B. And members may wish to draw themselves to that paper, which is very comprehensive. And actually, Simon, can I just say very clear? Over to you.
Thank you very much. I think we've all met in many different contexts over this kind of period of the COVID pandemic, and it just felt really important that we, as a Health and Wellbeing Board, kind of just log the way the pandemic progressed, some of the potential health impacts, and then I've got a little bit on the outbreak control plan. But I'm very aware that many people have heard many of these things in a number of different meetings. So in one sense, this is for our board itself, just to kind of log that. So I'll go through those 3 sections fairly quickly. And then I think what I was hoping to do is have a broader discussion about how does that impact on how we work at the Health and Wellbeing Board. So then I was going to do a presentation on the kind of strategy going forward, if that's okay with everyone.
Yep.
So this paper.
Simon, sorry, pause. Can I just? Are we going to deal then in that way with this item and the next item through that discussion?
I'll do this item, and then that will help us guide into the next item.
Thank you.
So this report sets out the pandemic context, impact on health and wellbeing, and the outbreak control plans. There's much more going on in this space, so it's just really important to kind of clock a few of these things. So the pandemic context, if you look in paragraph 5, I think we need to remember this first brand new virus came to light in December 2019. So it's 6 months old, and we've learned a lot about it since then. And it's really important to think about where that came from and how that emerged, and what we're learning about this COVID-19 disease. And as we said there, coronavirus does cause a number of mild illnesses, but COVID-19, the impact on somebody's health has been extensive, and we've seen some kind of really severe impacts of that on individuals and on the population. Bear in mind the individuals affected, those over 70 are more likely to be affected, those with underlying health conditions, and we found evidence now more recently emerging about the impact on BAME communities and those individuals with obesity. So that's in paragraph 7. Sorry, I've just spotted a typo because it says in Hampshire. Apologies for that, that's me rushing at pace. We did see a steady rise in cases, not greatly on the Isle of Wight, and I think that's worth just remembering that actually it was okay, and we've managed really well, and there haven't been a huge number of cases, and that's really, really positive. Again, unlike other parts of the country where we've seen that. We moved to a kind of phase of containing the disease, so thinking about tracking at the beginning. You may well remember way back in February, we were tracking all those who had the disease coming in from different parts of the country, and we had the kind of people come from Italy. And then in paragraph 10, we're talking about delay and working across the council. And as public health, we worked across both Hampshire and the Isle of Wight council. And then just before paragraph 12, you've got that graph that shows the first wave and the potential second wave. And as the papers come out a little bit earlier than the graph develops, we can see actually we haven't seen an increase yet. We're still in a really downward trend, and I'm really pleased to report that within the last 7 days on the island we had no cases of coronavirus. So that's no new cases. So that's really, really positive. We've got a huge program of testing, and it's proving hugely complex, bringing a number of different testing programs together under one roof so that we can really test the people we need to test. And now we're testing everybody who's symptomatic. That's very positive, but it's still quite complicated if there is an outbreak. And now we're moving into the outbreak management phase, looking at testing and tracing, working across all partners to prevent spread of infection, and also to manage outbreaks quickly should they appear. And there was the mobile phone app. Sorry, this paper is a little bit out of date. I had thought I'd update it. So there's a number of things there. So that's the kind of where we are in the context of this pandemic. Paragraph 16 really sets out some of the impacts on health and wellbeing. Now they're not fully known yet, and I think we just need to be aware of that, and what we need to do is some work, and I suggest this board oversees some of that work to understand really the further impact, and where we then, as I said later in a discussion, where we then need to focus our efforts as a board. So we did see a drop in urgent care use for strokes and heart attacks, and treatment delays for cancer. Again, some non-acute care in general practice was impacted, and those are long-term conditions. And I know we're picking all those things up, but this is with the impact of the pandemic. And then we need to think about low immunisation rate, possibly getting a surge in vaccine preventable diseases, and then the backlog of cancer screening. So we can see that there's been a possible huge impact on the physical health of our population. We need to really keep a strong eye on that to make sure that as a Health and Wellbeing Board, we're sighted on the key impacts. And then the mental health impacts have been talked about a lot, and we've tried to summarise those here. And the diagram in paragraph 21 kind of sets that out, stole it with pride from Hertfordshire, about some of the impacts across the life course of the COVID pandemic, and then thinking about the long-term impacts of those kind of things that people are a bit struggling with, you know, financial worries, isolation, relationship challenges, and down to genetic abuse. So there's a number of things there. And also we should really think about the effects of the pandemic on bereavement. So actually a number of people have been bereaved. As we know, the death rate has been low on the island, but we have seen people die of COVID and other things. So how do we kind of really support people to have a really strong approach to bereavement? And again, I'll pick that up in the next presentation. So we've got strong physical and mental health needs being addressed through the LRF and now more locally. So we've got some good mental health work going across the system, and also thinking about our physical health. Leader, I will pause there because I think most people have heard about the outbreak control plan. I'm very happy to give an update on that, but it feels slightly different tack. So shall I pause there and take any questions on the impacts?
Yeah, thank you. I've got one question, then I'll go around the panel members to see what other questions are there. It's a slight aside. You may be aware, I'm sure you are, of the recent scientific report that's come out about the impact the app had on the Isle of Wight, where it's indicating that because people were downloading the app and therefore following the process, we had a significant reduction in our cases on the island, something which I've been asked to speak at on another forum. And I just was going to ask you, have you got any observations on that aspect?
I think for me, with the app, there was a number of programs that started off really well and really early on the Isle of Wight. We had the test and trace that kicked off as well, so that was the program we've got nationally, and the app. I suspect it's quite hard to unpick which bit was the impact, the positive impact. I think what we can say is the way that we came together as an island, really all behind this as kind of one voice saying this is really important, was absolutely essential for that. I think the comms were really positive. Then the way the community engaged. I think the other thing that was really helpful was the app was actually something people could do. So with that they like, you know, people like using their mobile phones rather than just thinking actually I've got to social distance and that's something I'm losing. They were taking a positive action. It's much easier to take a positive action against that rather than stopping someone do something. So I think it did seem to have a positive effect, but I think that was in the context of a number of other things, and I suspect the fact people could take action in itself may have actually helped them think about other actions they were taking. So I've downloaded the app, I must remember social distancing, hand washing alongside all the other things. So I think it was a really positive intervention in that sense.
Okay, thank you, Simon. I'll just go around the panel now if there's any other questions from board members or any other comments people would like to make. If you could just indicate, there is a technical way you can do it. Bob's is a very simple way because he's raised his hand. I don't mind that either, actually, but I can't see everybody. So, Marie, if you can pick up any indicates. I've seen Bob, Michael, Lily and Claire at the moment. So if I go to Bob first, if you unmute Bob and then speak.
Yeah. Can you hear me all right? Can you hear me?
Very clearly.
Right. The testing program where anybody who's showing symptoms can get a test. What I think concerns me is that people who are asymptomatic obviously may have the virus. They won't have a test because they don't have symptoms, yet they can still be spreading it without anybody knowing. This seems to me to be a problematic area. So is there any way that it could be rolled out to everybody on the island? I mean, we were used as a guinea pig basically for the app. Could we not be used as a guinea pig for more wide testing? And also, how easy is it to get an antibody test? I mean, a lot of people may well have had it and now got antibodies that give them some level of immunity. So what's the situation in terms of antibody tests?
Simon? Thank you, Bob.
Thank you, really helpful. So on the first one, asymptomatic testing. So we're doing that in particular settings where we know spread is much more devastating. So in care homes and other places. And if we have an outbreak, we do test people to find out if they've got it, and we will pick up asymptomatic cases that in that sense. We've got to remember we've got a very, very low prevalence of infection. So actually it's not effective to do asymptomatic testing because we'll start to pick up false positives, which isn't helpful. So actually, those people in settings where we need to test is really important. We do that, and we've been testing the rollout of the care homes program that Laura Godian has been absolutely central to, and her team, to roll that out. So that's really, really positive. There is a program in Southampton, which I spoke to last night, about doing weekly surveillance of people doing a spit test, because actually the test for coronavirus isn't very pleasant. And actually there's that was a government launched program, and it's coming to the end of its 3rd week, coming to 4th week. So they're doing a pilot to see if that works and how we can understand that. So I think we will see more of that kind of program going forward. We need to make sure we put it in the right context and the right people. So yeah, I wouldn't recommend asymptomatic testing for the whole population. It just wouldn't be cost effective either. On antibodies, so currently antibody testing is used for surveillance. It's not used to say, because actually it doesn't change your practice if you've had the disease. We still need to social distance, use PPE in the right setting, and make sure people are kind of following the good hygiene messages. What it's used for is to understand where the disease is spread, and also if we have antibody testing, if it's not changing practice, what's it doing? It's just going to show us where the disease is, and we know that at this point in time we're not sure the long-term immunity. So someone could have an antibody test and find they've got antibodies today, but we don't know how long that lasts for. So we know that also what's it doing is not really changing practice.
Thank you, Simon. Thank you, Bob. If I now ask Bob to mute and go to Michael Lilly. Unmute Michael, please. Can't hear you at the moment, Michael. Just speak again. You're muted still. If you could just try again, you're now live. That would unmute again, Michael. Try now. Oh, no, you've gone back on. Unmute again. Try now.
Can you hear me?
Yes. Oh, you've muted again. If you could unmute and repeat your words. No, try now.
Yeah.
Yes, you're clear now.
Okay, thank you. Something, no problem there. Just a couple of points, and then also a question. I think the app actually did have a psychological effect to focus people. In a sense, it's quite often in mental health you use a placebo effect, but it did actually focus people's minds, and I think we should learn from that. Also, the other thing that I focused things was the community response. The fact that very quickly, at the beginning of March, the voluntary sector with Isle of Wight Council and the parish and town councils mobilised. That meant there was a very strong community voice encouraging people to actually follow the rules. And I think that is a very good example, whether we're a small community, but we were very effective in that. I would like to say that the Health Scrutiny Committee is going to have briefings with the voluntary sector, and are going to focus on the voluntary sector in his next scrutiny meeting in September, because I think we do need to dig deeper about that, because I think there's some real lessons learned. And it's very interesting that public health are now working very closely with that community in looking at the support for the prevention of the outbreak in the future, and also helping people coming out of shielding. So I think that there's some interesting lessons there. My particular question, really, I suppose the worry of the community is we've got this double kind of whammy. One, we are a visitor island, and we rely very heavily on our economy for visitors. The Fast Cat is going to be coming back, which we're grateful, from the 31st of July. I think the concern is in the community, is there a danger that an outbreak could be triggered by actual visitors, not the community? Not intentionally, I'm sure, but how do we balance that our community needs as an island and those needs of the visitors? I do say that the charter that was being put together for visitors charter was excellent, and I think that's a way. But how do we work with the ferry companies, the travel operators and things, the industry, to make sure that we prevent as best as possible that route of the pandemic coming onto the island.
Simon, can I come in there just only to save you extending that one? Michael's almost recited all the things that are happening in order to achieve what he rightly points out. And I'll ask John Metcalfe to come in a moment on that aspect. There has been, and I have to say, there's an ongoing process for making sure that the message gets through to people that come to the island, that island is continued to protect. And we have to realise as well, there are a lot of people on our island who still are in fear of coming out of their house. And because not all of us are like that, we don't appreciate just how impactful that is. So I think probably easiest, I'll ask John Metcalfe, who's also on the call, just to deal with that, Simon, because I think it's in his area. And then I'm going to go to Claire after that. John, you'll need, I don't know if you're muted, are you?
I don't think so, Chairman. I think if people can hear me. I think I'd make two comments really in terms of visitors, and what we have done is we've taken all of the learning from the app and how we rolled that out and how we engage with the community, and we've very much engaged with the hospitality sector, working through organisations like the Chamber of Commerce and Visit Isle of Wight. So, environmental health officers and colleagues have been speaking to that industry for quite some time now and giving them quite a lot of advice about, how to open in a COVID secure way, what to do if people do suffer from coronavirus or have symptoms of coronavirus when they're here. And we've put robust plans in place to help people get home if they become ill while they're here with coronavirus, or they have the symptoms and they test positive. So I think that we're in a very good place in terms of doing that. The other thing I would say is that whilst we look at ourselves from a visitor economy, and we have got to prepare ourselves for that, we are quite similar to lots of other parts of the country, where I know that colleagues in the likes of Newcastle and Sheffield and Leeds and others are preparing for university students to return, because that's their equivalent of lots of visitors returning. So there's lots of work going on through local authorities sharing best practice about, how do you support the economy, but how do you support those people who are moving into an area and support the local community at the same time? And we're very well plugged into those activities, but a huge amount of our activities around campaigning and around messaging and around preparedness, as Simon will talk about later if he talks about the Outbreak Management Plan. Thank you, Leader.
Thank you, John. I'm going to move to Claire Mosdell, who's our lead member for a whole range of things.
Thank you, Leader. A sort of a question to Simon really about the wearing of face masks. I have to say that in some of the answers to visitors coming to the Isle of Wight, as you know, at the moment, I'm in Spain, caught the Red Funnel ferry, felt really safe. It was really well organised. Everybody who went, as soon as you were out of their car, everyone put their face on. And signpost, it was really, really well organised. And I've sat on a plane with everybody wearing face masks and have felt really, really safe. Over here in Spain, you can't get out of your car without putting a face mask on. You cannot in public areas. The beaches are really well organised, and everybody feels, yes, I'm near Alicante. In Barcelona, it's a little bit different, and they've got some cases increasing. But here where I am, it's really, really well organised. My concern is, in Spain, you will be stopped by the police, and you will be fined if you don't even have a face mask on you. I read social media, and like everybody else, and there seems to be more of a message of people who don't want to wear face masks, not even shops, in public areas. How do we get some comms out to show some of those questions? Like Bob said, if someone is asymptomatic, if you have a face mask on, you are protecting the person next to you, because that's more of, you're not giving it to anyone else. I don't think we've got the comms right on face masks and how that asymptomaticness and not spreading it and stuff like that. My husband has a heart condition, as most people know, and he didn't want to wear a mask and didn't want to come. And it was like, well, if you don't come, I'm going on my own. He has found wearing a lightweight, proper mask actually fine, and that this is in 30-degree heat. How do we get that across to people, especially people who are asthmatic, etc., that actually it's not so bad? Give it a go. There's more people trying to get exemption. And then my next question is, Simon, if people really do need an exemption, how do we do that without putting pressure on GP surgeries and people trying to get a special note to say they're exempt from wearing masks? Quite a few questions, but all about masks. And Michelle might want to give some of that impact from a GP perspective as well.
Okay, so thank you, Claire. If people don't mind, if you just come back through the chair and back out to the people. So I'm now going to ask Simon to respond, and then I've seen Michelle and Paul Brading. So Simon, do you want to respond to the points Claire's made? Thank you.
Yeah, many thanks, Claire. I'll just start off by, if you forgive me, let's think about face coverings here, because the face masks are the surgical. Really helps us to think about what people are wearing. I think you're absolutely right. We need to really promote social distancing, because the guidance says you should stay 2 meters apart. Where you can't, you should wear a face covering, and you're absolutely right. It's not about being protected from somebody else. It's about you protecting other people. So let's really think about our messages. I'm doing this for you rather than for me in that sense. And it is really important as we see that going into shops from tomorrow, where we have to wear face coverings in shops. How do we kind of really promote that? And also, you're right. Be kind enough to have the conversation. I saw a sign the other day. If someone tries to sit near you, let's be okay and saying, do you mind sitting further apart or moving away? And I know that's a difficult conversation. So how do we empower people to do that? You're right. We need to kind of continue to promote that. Social distancing is the key, because that's the best thing for us to stay apart, and where it's not possible, a face covering. And bear in mind that indoors as well. So that's why we're doing it in shops. Where it's not possible, we can't have COVID safe environments. So yes, I can take that away and work out how we get some really good comms, working with Wendy Pereira and the team on the right comms, and working in those settings that are more vulnerable for outbreaks. And what we notice, so listening to a couple of other outbreaks around the southeast, was that actually where these people are working, they were doing what we'd expect, good face coverings, or where they're going. Then they forget and relax and get in the car with their friend and forget. And there was a whole issue in a training session that a company put on really well. Everyone was kind of doing PPE, and then they all had lunch together and forgot. So it's just kind of remind people all the time, actually, you need your face coverings or PPE or whatever you're required to wear. And how do we keep that message? It's for everyone. But yeah, face coverings are important part of the armoury, but social distancing is much more important.
Thank you. I've now got Paul Brading, and then I'm going to go to Michelle. So I've just done the other way around. And Michael Lilly, I've picked up your request.
Thank you, Chair. Just a few things, actually, a few examples. I've been speaking to a few shops recently, and I'm involved in 2 charity shops on the island. The same question's been raised, really. If someone comes in without a face mask, we can say to them, you please wear a mask. If they refuse to do so, for a small charity shop to say, well, you have to leave, it's those powers, and that feeds into the communication piece. Interesting enough, I also went to Lake Parish Council, had a meeting last night, which was incredibly well organised, well socially distanced, everyone was wearing masks. But it was quite interesting, during the meeting, a member of the public was addressing the council and was gradually creeping forward. I believe Councillor Blizzard had to say to him, look, can you please respect socially distancing? When he was talking quite passionately about what he was talking about, gradually started to creep forward, had to be sort of corrected. But the thing, I pick on what Councillor Lilly said earlier, the app, we weren't guinea pigs for the app. We took this on to promote the island's safety, to be part of national rollout. But as Michael said, it really is about focusing the minds. That's the same with the spots on the floor. People are talking about the spots in the high streets, the red and white spots being, a deterrent, being scary. What it's doing is making people think. It's focusing the mind, as the app did, that there is a virus there. We do need to take it seriously. We do need to try and protect ourselves and protect others. And it's those messages, along with the visible signs on the floor, it's the visible signs in shop. It's just making people's minds focus on, look, I need to do this for the good of everybody. And I think those messages need to be keep pushing those messages home, because that's what will make the difference to the Isle of Wight. Goes on with the charter as well that we've done, the excellent charter. People coming to the island, it all helps to get the messages out to people, stay alert, stay sensible, and protect everybody. I think we've done a good job on that. Just need to keep it going. Thank you.
Yeah, no, thank you, Paul. I think that reflects that sort of multi approach to this, which has been good. I'm going to go. I think if I've got this right, I've got Michael Michel, but then I'm going to ask Sarah Jackson, who's on the call, if she's any observations about the enforcement aspect of this in reality. So if I go, Michael, I'm back to you, and then I'm sorry, Michel, I'm for you first. I did say to you first, sorry. Then I'll go to Michael.
Oh, that's all right. Thank you, Chairman.
Yeah, you're there.
Yeah. I think there's a couple of comments I'd like to make. When we introduced the app, it was the same time that we introduced lockdown and serious social distancing, and we often are behind the mainland on our prevalence. So I think a lot of things came in at the same time, but I'd like to echo comments that the app united people. It gave us a common thing to work towards, and I think people really got behind that. I'd like to very much echo what Councillor Brading said about comms. You know, we have to keep the communication up. There is going to be a chance over the summer with residents and visitors relaxing a bit. It's warmer. You know, we're not hearing quite so much about COVID on the island, although if you read the news or see newspapers, you see that actually worldwide COVID is a huge problem. But here on the island, I think we feel cushioned. So I think comms is absolutely vital. And just to get back to face coverings or face masks, medico-legally, it's very difficult for a GP to write a letter to exempt somebody from wearing a face mask. If we write a letter and then for some reason they infect somebody or get infected, where would we stand medico-legally? So actually our association, the BMA, has actually said that we shouldn't write letters for people. We should encourage people to wear face coverings or face masks. And there are a few incidences where somebody may, for example, with asthma, feel more short of breath with a mask on. But actually, I think as Councillor Mosdale said, you know, once you try the very lightweight surgical masks, they're actually quite comfortable to wear and they're not suffocating in any way. So it's getting those messages out on a regular basis that actually social distancing, hand washing, hand sanitising and face masks and or coverings are absolutely vital to keep this virus at bay, and to remind people that it is still out there. You know, it still is in the community, and we mustn't forget that. And that's what I want to say, Chairman. Thank you.
Thank you, Michelle. That was very powerfully put. Thank you. Michael, did I come back to you? If I did, then I'll move on to Sarah, but I can't remember if I did.
No, I didn't. So I just wanted to. Can you hear me?
Yes.
Yep. No, I just wanted to come back onto this issue of face covering and also social distancing. I think that we need to look at ways of perhaps, whether it's parish town councils, the Isle of Wight Council, getting people like the ferry operators to have available face masks that people actually can easily access at point, because I think the point of Paul saying, you know, difficulty in shops, I think if people are actually given one, right, or easy access to them if they haven't got one, because they might have forgotten, to say, look, actually, would you like a face mask, right, in a kind of gentle way. And it's something we're looking at Rye Town Council, whether we can, you know, do that and work with businesses and things to actually have that side. I think on the social distancing, what's quite interesting is young people around the island have been involved in sort of painting the dots, but in doing that, they've been publicising the issue, the importance, and in fact, in Ryde again, they made a very nice film about social distancing. I think we need to do interactive things like through art projects and things, perhaps working with public health, to educate people on the streets in ways of this, because normally through a bit of humour, a bit of sort of joy, actually people get the message better than being told autocratically. The other, I suppose my observation is particular areas like Ryde, Sandown, Shanklin, where you've actually got visitors and also residents coming to the beaches. When you actually look at people walking down the things like the Esplanade and roads, they're not social distancing at all. And I don't know how you get round that, but it is still, you're still having to, go around people. It's actually quite difficult. I don't know the solution to it, but when you actually if you got out today in places, particularly on the beaches, you would actually see that there is a lot of inappropriate behaviour.
Thank you, Michael. Sarah, are you still on the line? Okay.
I am here, Dave. Yes.
So I wonder if you could particularly perhaps cover the police perspective on the people that don't comply and what your strategy is, and then anything else in this particular area. I'm going to come back to Simon, which I've got a question for Simon on face covers, and then I would like just to move to mental health. So Sarah.
Certainly what we found throughout the period is that largely the public have actually complied really well with the regulations. I know we can all quote examples where we may not have seen that, but actually largely they have. So this is another example of where this has got to be a joint effort. So it's got to be about the members of the public themselves, and absolutely the retail sector, and of course policing. So we very much need retailers and expect them to take responsibility for the safety of their staff and customers, and expect them to be really clear about the requirements and to manage their own premises. From a policing perspective, we will adopt the same approach as we have to all of the regulations, which is if we are asked to intervene, we will talk to the person, try and get them to understand and explain why they need to wear a face mask, and encourage them to do, a face covering, and encourage them to do so. But ultimately, if needs be, then we will move to enforcement, but that will only be as a last resort. So we will be adopting that approach in relation to this as we have with everything else.
Thank you, Sarah. That's very, very informative. Claire, did you want to come back? Claire Mosdell, you need to unmute. Just give it a few seconds. You're now clear.
It's amazing what happens with the general public when you're in an area and there's only a few people who haven't got them on. The rest, everybody else just glares at them. So we've been in a supermarket where somebody was wearing the mask on the chin, and practically everybody who walked past them looked at them like they were social lepers. I think you'll be amazed from tomorrow how many people will wear them, because it's not a sheep instinct. It's actually, you want to do what's right for your community, and actually most people don't want to stand out and be the one that's not wearing it. And you do really, really quickly get used to wearing them in most situations. I know I feel happier walking along a busy street now, having my face covering on, and it just becomes a bit like second nature. You get out the car and put it straight on. So it's not that hard, but actually it's probably harder in a shop from tomorrow not to wear the one.
Thank you, Claire. I've just written out a little catchphrase now. Our island's got it covered. I think we could really push that. I think it's a good point. I wanted to just move, Simon, it's one element out of your report, which it's actually paragraph 20. And it says, lessons from past epidemics are also helpful to understand some of the impact on mental health. If there's one thing I've picked up from everybody that I speak to, they've talked about the mental impact this has had, and it's very different for different people. Some people it is just not being able to, hug their family. Others, it's the psychology of walking out of the door. Others is not understanding whether if they catch this virus, it's going to affect them forever. So there's a whole psychology going on, and I just wonder if there's anything more we should be thinking about doing as be a strategy for the board to try and penetrate this this element of the impact. So is that question clear to you?
It is, and I think I'll probably be quite vague, but I know that others are much more closely involved. So we have really recognised the mental health and well-being aspects of this pandemic, and it's great that we haven't forgotten that, because actually it's not just about the disease itself. And I know through the Isle of Wight Council Recovery Programme, we are linking really close to make sure that mental health and well-being are part of that, because we want to enable people to have good mental health and well-being, working really closely in that space. But also working across the island, working with the CCG and the NHS Trust and others to ensure that we have a joined up approach. It's not just about mental health treatment, it's about that kind of broad approach to enabling people. And I think, again, we've seen in the last, 18 months or 2 years, a change in people's attitudes to mental health. We had the heads together with the Prince William and Prince Harry probably about 18 months ago, where people started talking about mental health. And I think also people are being able to talk about it a little bit more openly around coronavirus. As he said, people are struggling not being able to hug their family or worried about going out, and we're all much more tolerant on that. And I think that's really, really important. So I think you're right, Leader. If we could bring that plan here, that would be really, really positive to be able to show the work we're doing. I think it is going on, but this board isn't cited on it. And I'm not closely cited on it today, but I think it could be helpful to bring forward. I'll stop there before I ramble, and others who are more close to that work may be able to share other bits of information.
Okay, so thank you. Coming back through me again, I think we'll put that on the agenda for October. One of the other, say frustrations is the wrong word, but realities that does dawned on me myself in the last 2 weeks is whatever happens with vaccines, our current position in what I call the new kind of way of working isn't going to go away this side of the end of this year. So it's understanding that all of this is still here. My biggest concern is the island gets complacent, because it has done really well. So highlighting things like the mental health impact, the simple thing about covering your face and washing your hands, is a payoff really for having ourselves in a place that others would only dream of being. I'll put it like that.
Absolutely.
So there we go. Okay. So I'm open to any other questions on this aspect from Simon, for Simon, if you could indicate. If not, I'm going to ask us to note the report and thank Simon for the work he's doing, which I know goes well beyond turning up at our Health and Wellbeing Board. Michael, Chairman, I saw your hand.
Thank you.
Anybody else? I'll ask for Marie. Marie, is anybody else indicating apart from Michael, Lily? No. Okay, thank you. So Michael, you've got a final word of Bob Blezar's slipped in. So you got 30 seconds, Michael, and then Bob gets the other 30 seconds.
Okay, sorry, can you hear me again?
Yes.
The particular thing, we will obviously in October talk more about mental health, and I think that's a good time to review. My particular point is about loss and bereavement, which was highlighted. I think we need to start looking at making sure in our communities there are places where people can be quiet and grieve, right? That was actually in the COVID report. It was also in the crisis management documents and things that we've had for other kinds of events, about the importance in the healing process that people have somewhere they can go and collectively grieve, and whether it's loved ones that died or their loss of their whole life, and the need for rebuilding. We're going to look at St Thomas's Square for that within Ryde, and I'm sure it was the others, but I think there does need to be action to actually have a place in all our communities for people to go to have memories, to be able to start the process of healing.
Okay, if you, Michael, you could drop me an email outside the meeting on that. I'll discuss that with John and we can develop that, because I know Ride is leading on a number of areas and we're working closely with you on some very positive work. I think I'm going to go last 30 seconds to Bob Blizzard, and then I'll propose we note the report. Bob? Very
quickly, Chair. The easing has meant that things like local cricket can restart, and I think restarted last weekend. Crowds are going to be able to come back to football. Apparently, I think the intention is from October.
Not that club you got behind you.
Sorry?
You won't get crowds at that club you got behind you on your wall.
I'm thinking more actually about local football. Is there a timetable for local football to restart?
I haven't heard anything, but I can find that out, Bob. And again, outside the meeting, I can find that out because I've got connections with the local football.
There's guidance from the FA, which is coming out to local clubs.
And Simon, can I bring up one other aspect? Although it's an aspect on my ward, but it reflects itself in a number of ways. Throughout the summer period, various events have had to be cancelled or have been cancelled. I would go the Garlic Festival, the Isle of Wight Festival, Wonderfest. There's many. I then have another event on my ward being proposed, which is moving itself from Ride, where people will be invited to pay money to celebrate this particular event. But my concern is bringing any crowds of people together, irrespective of whether they technically meet the criteria of 30 plus or whatever, heightens the risk in a year when we don't even know what's going to happen on the second wave. In fact, they could cause the second wave. I'm probably going to go very public and speak out against any events, and I do empathise with the musical community particularly, and the those that have not been able to generate money. But I think safety first has to be the key. And I don't know, I'm not putting you on the spot, but I feel that's the right way to go across the island. Otherwise, all those people that didn't hold an event think, well, actually, why didn't we do ours? And it's all a bit sort of stupid.
So John's close to this in the regional group, but what I do know is that they're looking at, sorry, I'm a bit of internet connection, I'll come off my camera. We're looking at actually the impact of events and how events need to be COVID secure. So actually, can people social distance? Can people maintain the measures we need to, good hand washing and all those things? And I think we're going to be learning from a couple of large events in the southeast and see what happens. But it is really, are they COVID secure and can they manage that?
And as we saw last night with the celebrations of the Football Cup, alcohol seems to induce non-social distancing, unfortunately. John, did you want to comment on that?
If I may, Chairman, of course, any event needs to go through the Safety Advisory Group, which is a multi-agency group involving the police, the fire service, ambulance, the trust. So it would have to be looked at and advised on that particular basis. And of course, whether or not it can enforce social distancing and whether it's got that planned in would be a key measure in terms of the advice that was given. And certainly, I'd be looking for us to make best use of our licensing powers if the Safety Advisory Group had a view that an event couldn't guarantee social distancing and was going to put people at risk. So, any event organisers, and that's what's happened with all of the events this year that have had to be cancelled. They've taken the advice of the Safety Advisory Group and they've understood the issues that go with putting that particular event on. And of course, use it. We still have enforcement powers as well. So if people choose not to, then we still have a range of enforcement powers under various bits of legislation that we may choose to use if people are not following the advice of the Safety Advisory Group.
Okay, excellent. So members, if you're happy, I'm now going to propose that we note this. Sorry, who's that speaking? I can't see.
Marie, sorry.
Yes, Marie.
Serena O'Donnell's been unable to enter to be able to speak, but she sent me a question that she'd like me to ask on her behalf. Okay. She's asking about the psychological impact of quarantine, and that people who are quarantined are very likely to develop a wide range of symptoms of psychological stress and disorder, including low mood, insomnia, stress, anxiety, anger, irritability, emotional exhaustion, low mood, and specifically stand out as being very common. In cases where parents are quarantined with children, the mental health toll became even steeper. In one study, no less than 28% of quarantined parents warranted a diagnosis of trauma-related mental health disorder. Are our mental health services ready to deal with this?
So we will provide an answer through our report in October, but I think although she's made a statement as a question, I think it's very useful, and we'll include that in our preparation. I can hand that straight to John. But I think it will be a good thing for us to look at the mental health impact in slow time, but come to a view on this, and then I think linked to that would be steps we can take as an island to reduce that impact. So that's something we can progress in October. So thank you. On the basis then, I propose that we note this report and thank Simon for all the work that he's done. And do I have a seconder? Michael Lilly, thank you very much. Okay, we move on now then, Simon, to the other part of the element really, which was discussing a general discussion around the, I'm just trying to get my agenda back in the right place, bear with me. Taking account of our strategy and discuss the future of the Health and Wellbeing Board and focus on how this can be achieved. And we were kind of linking this, I think your aim was to link this into everything that's happened and whether we are now as fit for purpose as we might have thought we were. The strategy is due to complete its journey and be looked at in 2021. There are a number of strands to it. I don't need to go back through it with members, but you will we had a whole sections of areas, and the LGA have also now published some very useful data and information around the whole health and wellbeing agenda. So it is timely that we do a review, not for today necessarily, but this is a bit of an open thing. You actually, as long as you don't speak forever, there's an opportunity to have some of this free speech now if anybody would like to. But do you want to introduce the topic, Simon?
Yeah, thank you, leader. I was just going to do a very quick presentation just on some of the where we got to and where we wanted to move forward to, just so people were aware. It'd be very quick, and then also bring in some of the kind of role of the ICP and the ICS and what that's doing and how we just make sure that we work together, because what we don't want to do is have different people sitting around different tables on different days, because we met yesterday as an ICP doing the same thing. So that's what I'm planning to do. It is my kind of collective, my thoughts for discussion, to stimulate discussion rather than anything else. So don't, it's not taken as read. I'm going to try and share. Has that come up as a presentation?
Yes.
Great. Oh no, I'm struggling to work out how to do this. So tell me, so a kind of a quick recap, review and refresh of where we're going to. In terms of the presentation, I'm moving through the slides. So, this was in the last strategy. We're thinking about the influences on health and well-being, the lifestyles, our jobs and our homes, with everyone on the island having a right to good health and well-being. And then the kind of final bit is about the inequalities, and we've seen a lot about that in COVID. So I was just going to pick up some of those things we might want to think about. This next slide just kind of reminds people of the vision we had for the island, which I think still stands really positively. And interesting, I looked at this earlier in the week, the number of strategies, and I think they're probably a little bit out of date. We've got a number of strategies on the island and wider that we're part of. We don't have some of the economic strategies linked, but obviously we know economy and health are very well linked together. So the next kind of few slides are going through each section. So we had starting well, about improving children's resilience, and also developing integrated prevention and early help services, which I think we have probably moved forward, and just kind of acknowledge them. So this is what we said we were going to do, kind of whole school approach to family centre approach working, and we've done that through a program called Peach and other things, particularly with children's services there, and establishing an ICCU. Now I think what I've noticed is some of these actions are really, really specific, and as a board we probably want to lift our head up and work out actually where do we want to go and what do we want to do. So the next slide is about living well, 5 priorities there, thinking about those key things for our island. And I was just reflecting, I think it was Zarina's point, number 4 there, adverse childhood experiences, and we know that if we can tackle those as a system, that can be really positive. And I think we need to think about maybe some of the experience people had in COVID as linking to that category of adverse and not helpful and positive and good. So those are the things we said we'd do. A homelessness strategy, which I know has been taken forward. I've had a lot of conversations with Chris Ashman about place shaping, and I think just before lockdown we were going to have a health and wellbeing presentation between Chris and myself thinking about how we do place shaping, which I think would be great if we could bring back in October, if that's okay. Think about communities and neighbourhoods, which Michael Lilly has very well articulated this morning. And then we've had a big conversation on ACEs. And then the final one is about co-occurring mental health and substance misuse, a really key issue. I wonder if it's really important how we as a board want to focus on that. I'm not sure. The third area was age well, really important. We do have an older population. How do we prepare for older age? And our public health strategy is also focused on that. And then thinking about carers and inclusion independence through social networks, again raised earlier today. And those are the things we said we would do. So our asset-based, strengths-based approach, absolutely key. Thinking about carers and the role they have and the really important role to support carers. Working with partners in communities to ensure people can have control over their own lives and kind of rather than be done to, we do with them and they do what they want to do. And then kind of thinking about the isolation bit at the bottom, how do we kind of prevent social isolation? So that's where we were. As I said, it's going to be a quick canter through. Where now? So as you said, Councillor Stewart, we're preparing for 2021. So what's new? Where are we? I thought this graph was quite helpful in terms of thinking about the
reactive.
In COVID, we've had the waves, we've had the impact, and whether the different waves here are quite right, but I think for me, interrupted care on chronic conditions and thinking about frailty and how some people have come out of intensive care and the impact on their lives. And also we've talked about the mental health aspect on the top right hand corner.
Yeah.
And having a really positive conversation with Nigel Hartley from Mountbatten. Actually, do we need to really think about what our approach to bereavement and dying is, and how do we, and I'm not, the phrase isn't quite right, what about, and we've just learning from across the water, how do we want to think about dying well as an approach across the island to make sure we all work together. This next slide I did steal from another health and wellbeing strategy in London, but I thought it was really helpful because at times I'm getting a little bit, we don't want to get tied up in what's for the integrated care partnership and what's for the health and wellbeing strategy. I really see the health and care services and the role there for integrated care partnerships and that, and this wider determinants healthy place may be the place that the health and wellbeing strategy needs to focus going forward, just to make sure that we don't duplicate and we have an effective health and wellbeing board. What I've done here in the next couple of slides, I won't focus on these two, is what the ICS Hampshire Isle of Wight has said, and I've highlighted on this slide. So slide 16. I know Sarah's got the pack I sent you earlier. The areas where we might actually want to focus our efforts to make sure that we are doing some really good work. So thinking about the social determinants, thinking about those trauma-informed approaches and violence, and thinking about air quality that maybe would support our role in the ICS, but actually give us a really strong role to take forward as the Health and Wellbeing Board. And then also not forgetting on slide 17, the inequalities and making sure that we don't forget those. Some people will have worse outcomes, not just from COVID, which we've seen really explicitly identified in the disparities report, but through different things. So the life expectancy gap between the rich and the poor, or the deprived areas, and how we kind of really support that, and looking at healthy life expectancy on the island, what's going on, the gender gap there as well, we just need to think about. So just Simon, finally, yes.
Just interrupt you, just a question coming up as we go along. Could we email the slides to the board members?
Yes, of course. Yes, I will do that.
I can't see any reason why we couldn't put that on our web page. So that
I might need to just amend a couple of the slides where I've stolen from elsewhere, but of course.
Yeah, just so the public, if they wish, and then different people need to see different things. That keeps it very transparent then. Thank you.
Yeah. And so I was wondering about the role of the board. What do you want to lead together, which might be some of those things suggested? What do you want to champion? And just because it's top of my mind, actually, is it about flu immunisations? Do we all want to champion that? And what areas of work do we want to watch as a board? So that was my really quick canter through. So actually, as you said, Dave, to have a discussion rather than.
Yeah, no, Simon, thank you. I do have I won't do it yet, but I do have a proposal as to how we can move forward. and the conversation around mental health has improved that as well. There's a couple of things for people to know about, which just build on to Simon's. So the Island Plan, which is being reviewed and developed as a direct result of the COVID-19 impact, we are deferring the plan outcome at the moment so that we can take account of some of the very important issues that have been mentioned today. And I particularly like that healthier place reference. And I know that Ryde and Newport, as leaders on this, are with our historic towns looking at how we can make places healthier. So that's a really good link in there. If you'd like to just make, and these are open observations on this, if you can just indicate, and I'll ask Marie to try and pick up the indication so I don't miss anybody.
Yeah, that's okay.
So, Chairman, as Chief Executive, you've got Councillor Lilly who's indicated to speak.
Thank you. Michael, do you want to speak? Take off mic now. Michael, I'm sorry, your mute is programmed to come back in automatically after about a minute. Just so.
Okay, right. Can you? Yeah, I've got a few points.
Yeah, that's right.
One just want to make about the place plan. Ryde having a place plan and approving a place plan in February was amazing for what we did regarding COVID-19 and supporting our community. I really do feel that, and for going forward, so actually I wish to advocate that having a place plan, which we did in partnership with Isle of Wight Council, has actually proved incredibly effective for Ryde, and actually has given us a real direction for the future and enables us to do the whole healthier place side. I do wish two particular things. We are looking in Ryde at well-being vouchers, particularly in partnership with people like Waterside and other sports and physical, to enable people to get back into doing physical activity. I think it's important to raise the issue of green space and environment. Actually getting accessible green space near to where people live so they can get out. That's been very important, and we've actually brought in 15 acres of land in partnership with Isle of Wight Council, which is actually really being effective in a very short time. My particular concern is people working remotely. We're all sitting in our households, or some of us are sitting in Spain. I think we can't underestimate the psychological effects of some people that it is not working. For some people, working remotely has been a godsend, and they, have changed their view of things and actually enjoy it. But there are many people who are really, really suffering. And actually having to work remotely when you live in a 2-bedroom house, got 2 children and a dog, etc., is very, very limiting to actually be working on Zoom or aside. So I want to add into that, Simon, to propose that we also look at the health and well-being of people who are now working from home, and then there's also the area of unemployment, because there is a lot of people who are going to be faced without work, particularly people who rely on perhaps 1 or 2 jobs just to actually get through that. A lot of seasonal work, contract hours, etc., and a lot of that work is going to go. And so round employment, I do feel is an important area that we should look at.
Thank you. I'm going to come on to Claire shortly. Just try and summarise a couple of points Michael's made there. So the green space and the environment, that echoes the point about why we are looking at how our island plan will be developed going forward, because we've identified that. The remote working, it is a big psychological issue. It varies for individuals, and there is a loss of social engagement which comes with social distancing and working from home. There's an economic benefit from working from home, which many people have found, but you're absolutely right on that one. And then the unemployment, it was interesting because the data I received a few weeks ago that normally at this time of year, the Isle of Wight would expect to have about 2,000 people unemployed. This is roughly, and that figure would go down during the summer. We've got 5,300 unemployed, and the figures are going to go up as the furlong comes in. So it is a significant issue, and we raised it at our Economic Development Board, because unemployment leads to mental stress, and so the circle starts to be filled in. So thank you for that, Michael. I'm going to move to Claire, and if anybody else wishes to speak, if you can indicate either with your hand up or on the chat line. Claire.
Yeah, thank you. I have said for quite a while that, you know, we have to have a level of understanding about people working remotely from home. I know Laura's on the call, and, you know, we have to, for example, some of our teams that work within adult social care, a lot of the work that they do, especially with social workers, is discussing things, you know, between each other. And, you know, and at some point we need to have that understanding that people will need to start working back and having that interaction. For me, I think working from home will only go on for so long. The country has been really brilliant at, you know, and you think what this council did, and basically within 48 hours we had so many people working from home. You know, we were ready for that level of agile working. But actually, the unions eventually will start getting involved in this and saying, if you are working from home, you need to have the same type of safe environment that you would have if you were working in an office space. If you work for the council, you would not expect someone to work in a situation where they could end up with RSI, that they ended up having, you know, neck strain because they don't have the right seating. And we have to accept that eventually there will be that question, is your working from home in the right safe environment that you would have from working in an office? You know, I know at the very beginning, council leader knows I was probably doing about 80 hours a week. And actually, I always had an office at home, but I quickly had to get a different chair. So I was working on the right angle because I had neck strain, all those different things. And I know it sounds bizarre, but actually, when you start working back in the office, there is that wider impact of how much we've got used to working remotely and the environment that we work for. My cat, if I start going into long council meetings, will probably have to have some adjustment to it as well. We've got that level of how quickly we've adapted, but at some point we have to question, are we working in the right environments within our own households? And what duty do we have as employers to make sure that people are working correctly and safely?
Thank you, Claire. All very Laura, I don't know if you wanted to come in on the back of what Claire said. I'm not asking you have to, but you may well wish to do so, because I know this touches an area you've operated in.
Chairman, I'd echo the comments made by Councillor Mosdell, specifically in relation to the need for interaction between varying professionals and that shared professional knowledge and peer support.
Thank you, Laura. Anybody else wish to speak on this? Is it Alison? I think I can see your hand waving, but it's underneath my live sign, so I'll take a risk on that one. Over to you, Alison. Alison Smith, can you hear me?
Hello, can you hear me now?
Yes, I can.
Lovely, thank you. Sorry, I don't have a hand up button and I couldn't work out who was unmuting or muting me, but there we go. We're talking now. We have got within the CCG a whole series of assessments that we've done about workplace in the home, and it's a set template. Very happy to share that across the system for use, because we recognise very early on the risk that we would face as an organisation by encouraging people to work at home. So I'm very happy to share that through, and you can amend, adapt it. But it basically does a similar occupational health risk assessment that you would have in your office about height of the desk, the chair, how you sit, how your screen looks, etc., etc. And there are lots of now tools you can get to adapt your home environment so that you get that as good as you can, so you don't have any unintended consequences of backache, etc., etc. So I'm very happy to share that after this meeting.
Thank you for that. Just to prep Steve Crocker, I'm going to ask him what he knows about how Hampshire are approaching things, just to give himself a time to think about that one. Michelle, did I see you wave, or were you just waving? Michelle Legg. No, she's not there. Okay. So, John, should I bring you in just to give some observations? And just so that members are aware, what I'm going to propose is that John does a piece of work for our October meeting, but I'll outline that in a bit more detail. He's already cited on it, but it's been useful, John, listening to other people's views. John.
Yeah, thank you, Chairman. I think the one thing that we have to recognise as a Health and Wellbeing Board is to take that strategic view about, as Simon set out, what's right for the island, what's right for the place, and how we need to bring things together. And I think there is a role in looking at the strategy, which is rather about how we help the island to recover from COVID and what our role is in that to make sure that we're doing it in the right possible way. And therefore, I think that what we need to bring back to you as part of that strategy is, how we're bringing together the work around health and care and the work around rebuilding the economy and the work around rebuilding communities, and bring that together as a coordinated report back to yourselves, so that Health and Wellbeing Board starts to own that and has that picture about, what does the island look like and where do we need as individual organisations to put our effort, put our attention, put our energy. So my proposition would be that we think in that way, and that we try and focus our future conversations in October and January around trying to keep a clear steer on our recovery from COVID and how that links to our wider aspirations for health and wellbeing across the island. And as I'm speaking, I see that Simon and Sarah, both Simon and Sarah Jackson want to come in, Chairman, so I'll give you a heads up on that as well.
Okay, thank you for that. I'm glad you're observing. I'll go to Simon, then Sarah. Simon.
Thank you.
Yep.
Yeah, I'm just going to echo what John said, and I think it's this board's got a real role in kind of being the champion for the health and wellbeing bit. I think John's outlined, we need economic recovery, we need social recovery, and we just need to make sure as a board we are really championing the health and wellbeing aspects, which is what John was saying, and it's kind of, let's remember what we're here for, to improve the health of the population as part of the whole system recovery.
Thank you, Simon. I'm seeing the mental health, although it's part of the picture, as a slight piece of work on itself for October, and I'm sure Michael will engage with you directly because he has his own experiences of these, and I think we need to pull that in as a topic area.
Hey,
Steve,
Sarah Jackson's been trying to come in for ages.
Thank you, Claire. So Sarah, I'll come to you, then I'm going to go to Steve Crocker, who will have got his comprehensive response ready by now. Sarah,
thank you,
hello.
Thank you, Chair. I echo John's and Simon's points about the plan and taking that strategic perspective. And I just would really welcome the work around adverse childhood experiences and victims of violence. But also, I think we mustn't miss substance misuse as part of that for us here on the island, and actually how we commission services that are cross-cutting and that we are making the best use of the money we have available to us to support people who suffer from substance misuse.
Thank you, Sarah. Again, I'm pleased because all this will be captured as we go along in the minutes of the meeting. Very valid point. So finally, Steve Crocker, if you've just got a Hampshire perspective, and I don't know if it mirrors some stuff going on over there or they're taking a different approach, perhaps.
Well, exactly that actually. Is that we're very much in step in terms of how things are progressing. We've got some slight added complications. For example, we're talking about the return to work and so forth, but in Hampshire there are a number of buildings and offices that we use, and a number of those are shared with other authorities. So we share premises in Rushmore, Test Valley, Havant, etc. So we're having to agree with the local district council about how we the timing of when we use those buildings, etc., etc. But really there isn't much of a paper to put between the response that we are having in the Isle of Wight and the response that we're having in Hampshire in regards to children and what we're doing. And I think the interesting thing about this though is about what the world and what work looks like next year, and I'm cautioning people a little to be wary of being in a honeymoon period, as it were, because there are downsides to the new ways of working. Some people have enjoyed working at home, but we have to remember that some people haven't, and some of that some of those challenges are both gendered and sort of around family circumstances. So if you're a worker who's got 2 young children, your ability to work at home is actually quite compromised, and that all links to things like childcare being up and so forth. So I'm cautioning against jumping to easy solutions, whereas I think it'll be more complicated when we get fully back to work. I do think, though, that we've been able to make some big leaps forward in terms of the use of technology, and some aspects of our work will probably never go back to how they were. I think what's really interesting is the way that teenagers have embraced some of this new ways of working, and it's not that surprising, is it, that anybody like me who has teenagers around the house at the moment know that they spend a lot of time on their machines, but actually that's how they engage with the world quite a lot, and we need to do a bit of moving towards them in there and how they engage with the world, rather than expecting them to always engage on our terms. And I think that's been quite helpful. That said, there will always be a need for professionals to walk through a family's front door, find out what's going on in terms of child protection and so forth, and hear it, see it, smell it, and understand exactly the family's circumstances. You can't always do that by video. So yeah, I think but in terms of the comparative where we are in terms of between Hampshire and the Isle of Wight, I can't put a cigarette paper between the two, to be honest. It's very, very similar.
Thank you, Stephen. I think you've articulated some really important points there of, I think, issues yet to be uncovered, as I call them. The unknowns, or probably they are the knowns, but we don't have the evidence to support it yet. Yeah. And I think you're absolutely right. So that's really useful. And I've just actually made a note here, which is something I keep meaning to get into and haven't, which is young people's perspective, because the view is so different from young people's perspective, as you say. OK, so what I'm going to propose, board, is that we ask John Metcalf to pull a paper together which will give us a situation.
I believe Michael Lilly wants to say something.
OK, Michael, briefly, I'd like to pull this together now. No, he's not speaking. So
yes, sorry.
Yeah, speak briefly.
Yeah, it was just all I said was I put in support what Steve is saying. I think his particular point is really, really important, that there are actual people, and I know of one case where an employer's had to bring a single older male back into the workforce because it was either into an office, because it was either that or going to 7 acres. It was really, really isolating that person over the top. So I just wanted to say that what Steve said was absolutely correct, and that's what we need to also look at.
Thank you, Michael. Paul, I see you indicated, I missed that earlier. If you become our last speaker, then I'll just close this item off.
In addition to what you just said, as you know, we're in the process of setting up a meeting between the Cabinet and the Isle of Wight Youth Council, and it'll be useful at that meeting to seek their views on this particular point. At the same time, put it on our agenda for that meeting, which is happening, I believe, within the next couple of weeks. So we can put it on the agenda, and so we will hear the views of the young people.
Yeah, I think that's really good. Thank you, Paul, for backing that up. That's really useful. Okay, so what will happen then, action-wise? We'll ask John if he will, having listened to the whole of this debate and seen the strategic approach we want to take, if he can bring a paper forward for October meeting, which gives us a picture of where we are now and with some proposals going forward for the board. Separately, we'll bring in the mental health as a topic item, and we'll give some thought, Simon Bryant, to how we can now explore that agenda, which is something I think is going to grow as an issue as the reality kicks in. And I think then that would, at least then we can, as a Health and Wellbeing Board, move forward. And I'm quite keen, and maybe we'll see how we do this, to make a public statement about what we're doing, because we as a board meet, we've had a really interesting conversation. I think it's very relevant information. And I think the wider public who won't have been listening, because they'll be doing all sorts of other things, it would be quite nice for them to appreciate that the Health and Wellbeing Board, the whole partnership is focused on this and trying to make sure we're in the right place. So if people are happy, that's my proposal. I've got a seconder. That's the way forward. Paul Brading, thank you very much. Okay, last item on the agenda is members' question time. I don't think we've had any questions submitted by any members. Am I right, Marie?
No, none have been submitted.
So on that basis, members, we'll see each other in October, if not at some other fora. Thank everybody for joining the meeting and contributing. And like you, I'm probably moving on to my next virtual meeting somewhere. Thank you very much. Okay, I close the meeting. Bye.
Thank you.